from UCLA.
Is that reason?
No, that's
Kelly, you good? All right. Seeing that it is 3 p.m., we will get the Health and Human Services Committee meeting to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Item 3, public comment. We do not have anybody here or signed up for public comment, so we move on to item 4, approval of the January 31st, 2024 Health and Human Services Committee meeting minutes. Those are in your packet. Do I have a motion? Motion by Covelli, second by Gonnering. Are there any additions, corrections, discussion? All right, seeing none, all those in favor say aye. Aye. Opposed? All right, none opposed, motion carries. Thank you. Moving on to 5, policy issues, discussion, and potential committee determination. 5A, Lead in Water Grant Program, consideration whether to recommend to HR Finance and Property Committee and County Board to accept grant funds. Laura.
Okay, so this is in your packet under Grant Program, Wisconsin Lead and Water Testing and Remediation Initiative. Just as a reminder, we had an earlier grant that supported and enhanced our lead response. This is a different grant for a different project. This is lead and water testing specifically for daycares. It does support, enhance, and reimburses the health department for required lead intervention and abatement activities.
Thank you. Are there questions for Laura? And this item did go through the Board of Health as well. Right, seeing no questions, discussions, like our agenda states, we need a motion to recommend to HR Finance and Property Committee and County Board to accept grant funds. Do we have a motion? Motion by Covelli, second by Arstead. Any discussion? Right, seeing none, all those in favor say aye. Aye.
Aye.
Opposed? All right, none opposed, motion carries. Thank you. Item 5B, Nicotine Prevention Alliance of Central Wisconsin Electronic Nicotine Delivery Grant Vaping Prevention, Treatment, and Intervention. Consideration whether to recommend to HR Finance and Property Committee and County Board to accept increased grant funds. That again is Laura.
Hello. Okay, so in your packet, you have the Nicotine Prevention Alliance of Central Wisconsin Electronic Nicotine Delivery Grant for vaping prevention, treatment, and intervention. And it's a white paper. Just as a reminder, in March, I brought before the Board of Health this committee, and it went through to accept $29,675 so that we would, as Marathon County Health Department, be the fiscal agent to the Nicotine Prevention Alliance. And there would be essentially anti-vaping mitigation. It turns out that there was additional funds that were available by the state, so we went forward, and we'd like to approve the additional funds so that that would, again, be put forward for the Nicotine Alliance, which serves not just Marathon County, but also, let's see, it was Wood and Portage as well. And so the additional funds were being granted $63,079 total for in the contract year.
Thank you. Are there any questions for Laura? Supervisor Covelli?
Sorry, I might have missed it in here. Where are the funds coming from?
The funds are coming from the Department of Health Services.
Okay.
And it's because of the Juul. There was litigation against Juul for essentially advertising to minors, and so those funds are being sent through the system.
Mm-hmm. And Juul is a brand of...
Yes, a vape
Yep.
brand, excuse me.
All right, any other questions or discussion? All right, do we have a motion then to recommend this to HR Finance and Property Committee? Motion by Arstead, second by Krause. All those in favor say aye. Aye.
Aye.
Opposed? All right, none opposed. Motion carries. Thank you. Moving on to item 6, operational functions required by statute, ordinance, resolution, or policy. We have none today, so it brings us to item 7, educational presentations and committee discussion. 7A, anticipated transition from traditional shelter care services delivery model to the Youth Opportunity Center delivery model. Krista?
I have a PowerPoint, so
Okay. I think we still have plenty of time, so we don't need to worry.
Sure, I can kick it off since I'm up here. Chris is going to tell you about this, what I think is a really great service delivery model, but just to ground everyone, kind of, and again, the difference between what we've kind of termed historically a new program or a new service versus a delivery model change. This is kind of the latter of those two. We've historically delivered what we kind of refer to as shelter care services, or we've procured shelter care services or report center services. And this Youth Opportunity Center that Krista and her team have put together is really just a different delivery model to achieve those same goals. So she'll talk that through, and then not looking for any action, again, just to ground the committee, because it's not really a change. This is fundamentally the same sort of idea, a real simple example. If the county board allocates money to a facility project, a couple of years ago we allocated money to add 2 hearing rooms down the hall to allow court commissioners to hold court. There are 2 ways we could deliver that capital project. One, we could put it out for bid and have Lance's Construction respond and run the project, or we could self-perform. The board doesn't get in the weeds of whether we self-perform, that is, have our own facility staff do it and purchase the materials and run the project ourselves, or if we go out for and procure those services. This is kind of the same approach. Krista is going to tell you what our old approach was to getting these services and how this new approach, this new delivery model, what we're going to try. I mean, we're going to hear about it as essentially a pilot, but just to ground everyone on why we're not asking for you for a budget amendment. Simple answer is it's not asking for more money. Our hope is it's going to be less. And there's no need for the board or this committee to take action. All that said, we're excited about it, and we wanted to make sure you were aware of it. So if you do get questions or hear about it, you're informed on kind of that process and that background. So with that, and all technical issues aside, take it away.
Thank you, Lance, and thanks for your patience as we got this up and running for you. All right, so as Lance said, this is really a service model delivery change that we're looking at. And we've put in a lot of thoughtful planning behind modifying this service model to transition from our traditional shelter care model for at-risk youth in Marathon County to the establishment of what we're calling the Youth Opportunity Center. And so Marathon County, like many, faces the challenge of providing beneficial support services for our at-risk youth who require additional supervision and guidance. We think that the Youth Opportunity Center will provide those targeted interventions for those youth based on an assessment tool. It's called the YAZI, that youth justice workers complete that talk really about what their risk levels are, their protective factors, and all of those pieces. We think the Youth Opportunity Center model is established to really provide a place that is empowering to our youth, that's uplifting to them, while reducing the necessity for out-of-home placements and maintaining youth in low-level placements within our community. So our traditional service model that Lance was speaking about is what we called shelter in the past. And so shelter was expensive. It did not have programming, no skill development. Kids went there, they had a roof over their head and food in their bellies, and that was it. There was no programming or anything of that nature that happened. It was utilized for sanctions, so when a youth might violate their court order and they would get a 3-day sanction, or like a timeout, if you will, they would go there for those services, and then out-of-home placement. So if we had a youth that was transitioning between a lower level and a higher level, and we needed a place in between or something like that, they might just sort of be housed there for a period of time. This service model change is a much more cost-effective alternative. It provides for that programming that didn't used to be provided out at shelter around accountability, mentorship, skill development, and then those targeted interventions based on that assessment screening tool that the youth justice workers complete. And there would be no out-of-home placement. So traditionally, this was counted as a placement for youth. They stayed there overnight. They did not return home. This is not an out-of-home placement. They would go for the day and they would return home every single day. If you've had teens, which I think many of us have, sometimes it is easier when they are out of our home, and we have often ran into difficulties getting teenagers to return home after they've been out, because parents are like, this was a lot easier for me, I need this extra supervision, I need this extra support, and I don't have it. So these kids would come home every day. We would keep parents really engaged, and there's a family engagement component to this as well. So this new service model really is in alignment with the Federal Family Prevention Services Act, which we've talked about a little bit before, but is really to maintain low-level placements, maintain children in your communities, and increase community supports to avoid out-of-home placements. It provides that comprehensive blend of that accountability, structure, education, and connection that we spoke about, and it really seeks to collaborate with our various stakeholders like North Central Healthcare, Positive Alternatives, biological and foster families. And then, excuse me, minimizing the need, as I just said, for those costlier and more disruptive measures of out-of-home placements outside of our community, et cetera. So prior to December of 22, Marathon County did utilize 2 agencies. The Sheriff's Office ran our shelter care, and PSG delivered our report center services to youth. Both of those were funded in large part by tax levy. Shelter care provided that accountability through that consequential out-of-home placement that we talked about, whereas the report center really provided services for youth such as education groups, community service work, homework assistance, more skills development. And then following the closure of the shelter, a portion of those funds was transferred to the Department of Social Services to run an alternative to shelter program. PSG ended their report center services in 2019. They moved out of the area and stopped providing those, and we have had nothing in between. So with the closure of shelter and not having report center services, we really don't have anything in this moment for accountability for our youth, for additional structure, supervision, and as we'll talk about, really connecting them to individuals in our community to keep them here and pipeline them into things and give them a lot of skills. With report center closing, we got the $322,925. That is the total amount that was transferred to social services when the shelter closed. So the question is, who does this really serve? It sounds like it could be a large variety of kiddos, and I have a couple of examples for you, so I'm going to hand those out now. Just really gives 3 different scenarios.
You have one online, so just, I can handle it.
And we can do these. All right, so I'm providing 3 different scenarios of youth who might utilize the report center. These are situations of youth that we do currently have in our community. Their names and demographics have been modified, so there's no identifying information. But I thought we could just take a minute before we move forward with the presentation to read about these 3 kids. And so I can read their scenarios. 16-year-old youth Duncan is sending pictures of himself holding a handgun and making threats to kill a community member. Initially detained at Secure, he will be released on monitor back to his parents' home. Both parents work during the day, and he is being suspended from school for the next week. He would be appropriate based on his risk to the community safety and needing additional supervision because of his suspension from school. So this youth typically would have just been at home without that extra supervision, knowing the safety concerns that were present, and instead of him potentially staying home and causing more community safety risks, we would have him come out to the Youth Opportunity Center during the time he was suspended, provide him with some homework assistance, provide him with skill building, talk about the things that have been going on, and see how we can engage that family to help to mitigate those concerns. The next scenario would be a 14-year-old Robert who is placed at Positive Alternatives. If you're unaware, that's the group home that Marathon County currently contracts with on a regular basis for our kids. He's doing online school for half of the day based on his individual education plan. His days get to be long and he gets bored at the group home and then begins attention seeking by making inappropriate comments towards his other peers, creating power struggles within the group home, and sometimes escalating to property damage. Robert would be appropriate based on needing him and the group home to have a break from each other, which then reduces the frustration that group home has with him and reduces the likelihood that the group home indicates they are not the right setting for this youth. Typically, if a youth is removed from a group home setting, they are going to a higher level of care, such as a residential treatment facility, so that they can receive the appropriate supervision that they need. Our last scenario provided today is 15-year-old Brenda. She has returned to our community from a residential placement and is currently placed in a foster home. Brenda's foster parents work until 5 p.m., and Brenda cannot be left home after school unsupervised. The foster parents indicate the only way they can accept placement of her is if the department is able to find a way for her to be supervised after school. Given Brenda's previous delinquency behaviors that led to the residential placement, it would be appropriate for her to attend the Youth Opportunity Center, receive supervision, along with more skill building that leads to her success. So the Youth Opportunity Center is a place for our moderate to high-risk youth who are on court order who would be a risk to our community. So we're talking about 12 to 17-year-old youth in the youth justice system, and again, who meet that risk factor according to their assessment, who are not abiding by their court order conditions, require a higher level of accountability and supervision to maintain in their home environment, or to maintain a lower level of placement, such as a foster home or a group home. In this center, we would be looking to serve up to 10 youth at a time, allowing for appropriate supervision and that a personalized and intensive approach to meet their needs. Again, these are court-ordered youth who could attend Monday through Friday between 10 a.m. and 6 p.m. So this really is to support our biological and our foster families, assisting families facing difficulties in managing the behavioral needs of their youth without having them placed outside of their home or in higher levels of care and more costly settings. It could support North Central Healthcare, CCS services. Youth who are on our youth justice orders often are co-cared for by North Central Healthcare through CCS to manage their mental health needs. And so this could provide additional supervision and structured programming for youth who might receive those sort of services through North Central in conjunction with youth justice, and provide a structured environment that would complement their mental health interventions. So we'd be looking at really having a wraparound approach where the CCS worker would be present. We'd be talking together about what are those youth's needs while they're out at the Youth Opportunity Center. And then also to our group home, Positive Alternatives, providing that additional skill building, structure, and engagement to provide for those gaps during their days, which can at times, as we mentioned in the scenario, lead to higher levels of placement if their supervision during the day is not needed. So these are the key performance indicators, or the things that we're really looking to happen because of the Youth Opportunity Center, and we've identified 5. The first being accountability, that at least 80% of our youth who attend the Youth Opportunity Center would be engaged in daily programs and activities. We would see a positive behavioral change in these youth, showing a reduction in their risk factors and protective capacities for the youth and their caregivers. Part of that would be based off of the youth assessment screen that we talked about earlier. We would look at youth having personal growth and development, that the youth themselves identify feeling supported, valued, and nurtured to acquire new skills within the Youth Opportunity Center environment, as well as key stakeholders in the youth's life identifying those areas of professional growth. So think about teachers, parents, neighbors, anybody who's a part of their support system. The fourth is family engagement. So initially I had shared that we'd be looking to have family involved in this process, which is something we don't currently have in any of our other programs that support this level of youth. So of the youth who are ordered to attend the Youth Opportunity Center, at least 50% of their families or their support network would be actively involved in the Youth Opportunity Center related activities. So that could be things like attending family meetings or participating in program related events, right? Maybe we're doing a community service event and we're going to ask family to come do that. We're volunteering, we're going to ask family to come do that. Maybe we're going to learn how to fix a hole in the wall that somebody might have made. Maybe family comes so that they can see what that process looks like to support their youth in those pieces going forward as well. And then lastly, we'll evaluate the impact on reduced recidivism rates. We'll have regular monitoring and analyzation of the relationship between the duration of those who are participating in the Youth Opportunity Center to their subsequent recidivism incidents. So we have a lot of great key factors, and we also want to make sure that our funding is appropriate. As Lance mentioned when he started this conversation, we are not looking for any additional tax levy to go into these programs, and we anticipate seeing a pretty significant amount of savings if you look at what we were previously spending on those shelter services and report center comparative to what we're looking at spending on the Youth Opportunity Center. So historically, the shelter facility has run with a $500,000 annual cost, and our report center contract was $120,000 annually, totaling $620,000 spent on these level of services. Our projected annual cost under the Youth Opportunity Center is half of that, $312,630. And for this first pilot period, I'll show you it here in a few moments, is even less than that. We're not functioning on a full year, and a few other key factors play into that. So as we said, we don't need additional tax money, and while we're getting this up and running, we'll be evaluating how we can incorporate those CCS services into the utilization of the Youth Opportunity Center to potentially offset even more costs if it's written into their plan. The other piece that really makes this program sustainable is the fact that we are looking at running this internally versus externally, as we historically have, right? Sheriff's Department running shelter and PSG running report center services. We did go out for procurement through an RFP process, and we did receive one proposal back that has the cost of $411,500 versus our internal cost management of $260,000 and some change. That's running the program just for 2024 from March through the end of the year. So that includes all of our startup costs, our staff costs, our supplies, all of those pieces. So that's why we made the decision that we could run this program internally in a more cost-effective manner, and it also allows us to have a lot more oversight of the program, of the staff who are hired, of the data that's being collected, how we're interacting and how we're engaging, the partners that we bring in, the volunteers that we bring in. So I think our internal model is really exciting for us to be able to deliver this. As I mentioned earlier, we do believe this will prevent higher level placements, resulting in a significant cost savings. If this Youth Opportunity Center prevents 2 youth from going into a group home level placement, it saves us $268,000 roughly. So over the cost of the entire Youth Opportunity Center for 2024, we 100% save our costs. If we prevent 2 youth from going into a residential care level, we save almost $450,000. It is typical, and we ran these off of 1 year, so an annual cost, because youth who typically enter a group home or a residential level placement are staying in those level of placements for a year based on our findings. It also alleviates costs to families. So historically, when youth are placed in shelter or secure detention facilities, families pay those costs. And so families would not have to pay any costs for their youth to come to the Youth Opportunity Center. The cost of shelter was previously $150 a day, and the cost of secure is currently $250 a day. We also have a lot of non-fiscal impacts and things that are hard to predict going forward around the improved outcomes for our youth and the strengthening of those family bonds and community reintegration. We all know that when a youth is placed out of their home, that's trauma, and what that causes going down the road, what we're able to prevent from happening for our community safety. We're not able to share that as a pilot program, but I think those benefits are going to speak for themselves. So when we look at how do we want to operate this Youth Opportunity Center, we are looking at having a lead youth justice worker identified. We don't currently have that. And so we will be hiring out of our current youth justice staff, 1 individual to take the lead on the Youth Opportunity Center. Then we would hire 2 additional full-time LTE staff, so we're not asking for any additional positions to be added. And then we will have our social workers who we currently have in our youth justice team. So if somebody calls in sick or somebody has to take a youth maybe to a court hearing or pick them up from school, we would have our current staff who would be able to go out to the center to provide that coverage. That could also include the youth justice supervisor, who's Becky Bogan, going to sit out there and provide that coverage as well. And then we're really looking at having a lot of volunteers and community partners. We have interns from time to time, but that's a little less predictable. But when I talked about, right, that youth learning how to fix the hole in the wall, or maybe it's a youth learning how to change the oil in a car, or just really life skills that a lot of these youth don't get, we'll be looking at bringing in our community members to provide some of that education. It also helps to build those relationships and those connections with those community partners, which reduces the likelihood that they're going to offend in your community when you have strong connections and you feel supported. So we're really building those support networks for those youth as well. We talked a little bit about the funding sources. We do have 2 primary funding sources. The first is the tax levy money that was transferred to the Department of Social Services that we'd already spoken about. And then we also have Youth Innovation Grant funding. This is a grant that we have historically received, and so we will be utilizing a portion of those funds for startup costs, things like purchasing supplies that we might need. So if you think about, well, we might want a few bike tires, we might want some fishing poles, we might want the drywall, we might want some music, we might want some art activities, just different things like that, so that we can really find ways to engage these youth in healthy activities to replace the unhealthy activities that we used to participate in. And then the location. The location has been very important. I think we started out really wanting something central, downtown Wausau, but then when we look at the population that we serve and the size of Marathon County, most of our kids are not from central Wausau. We serve a lot all around. And so it didn't really make sense that it had to be here, that it had to be on a bus line. And so we are looking at operating out of the old shelter facility. The county already owns and operates and maintains that facility. It would not cost us any additional funds. And it does does allow for a lot of green space. So when we think about activities for these kids to be able to do, there's a lot of green space out there. We're thinking about gardening, right, and different sports. We also have secure detention, which is attached. And so in the event that we did have a youth who presented with significant unsafe behaviors and received a charge for additional pieces, we do have also then the secure detention staff who could come over to support our current staff and the youth. So our timeline for this, we are looking to promote that youth justice lead worker this month. We have completed interviews for that process and have really great candidates internally, staff who have run similar programs for lower risk offenders. We have staff who have run programs at Lincoln Hills for higher risk offenders. We have a really great group of knowledge to bring to this kind of programming or service change, excuse me. So from March to April, once we have our lead worker hired, their role would really be to complete the policies and the procedures for the Youth Opportunity Center. So they'll spend a good chunk of that month getting those things in place. And then we would look at hiring those LTEs. We are planning to post for that position on March 13th and get those individuals hired and trained from April to May. So there will be a lot of training that goes into those individuals, depending on their history, around motivational interviewing, around redirection, around safety for other people. This is not a location where we're looking to do holds on youth, so we're not training on those pieces. We are not locking youth in rooms. None of that is happening. So this is a lot about redirection and engaging of our youth to get them to behave in a safe manner and engage and participate. And then June 3rd, so we'd be looking to, again, train those people from April to May, and then we're hoping to open and have youth begin attending as of June 3rd. So in closing, I really just think that this Youth Opportunity Center demonstrates our commitment to enhancing the support services for the youth that we have, providing accountability services, but also providing services that help to connect them to skills, to people, to really help their longevity of success remain in place. We are open to ideas. We are open to different people who might be able to come into the Youth Opportunity Center, and I know all of you have great connections, and maybe even you yourself would be interested. And so if you do have people who you think would be really great to come out to the Youth Opportunity Center, whether that's, to provide victim impact statements, right? Let's talk about what impact their decisions made, or to provide, I know how to fix a wall, I know how to change the oil, I know how to change your bike chain. I can't do that. All of those different things. Teachers, prior law enforcement, really anybody. So that's really our ask of you, is if you have recommendations for how we can make this more robust, how we can make this really stick for these youth. We are not talking about an evidence-based curriculum. We're not talking about sitting down and going through worksheets with these youth on a regular basis. And it's like, today we're on chapter 1, tomorrow we're on chapter 2. In fact, when Lance asked me about that, I said, well, my curriculum is called Human Interaction. That's what these youth need. They need mentors. They need support people. They need people who are going to be there and not give up on them and show them how to right your wrongs, how to actually make something different without them being in out-of-home placement and feeling like they're backed into a corner, and it doesn't really matter what I do because you already have me in residential treatment, so what more can you do to me? We can help these youth prevent that from ever happening, which, yes, it saves a lot of money, and that's great, but really it saves a lot of trauma, and it saves a lot of cycles of abuse and cycles of trauma from coming in for our kiddos. So thank you. I'm happy to answer any questions, and you also should have received a paper about this in your packet that provides any details that I might not have spoke about during the presentation today.
If I can just add 2 other pieces. You'll also would have seen this in the 2023, I'm sure you remember 2023 and 2024 budgets. We talked about kind of this being the plan of coming up with this delivery model change and a pilot. In the 2023 budget, we alluded to the change in shelter services and how the sheriff's office was no longer going to deliver that service. And then in 2024, talked about this model delivery change. And as Krista gave you, not only in the memo, but also in the presentation, their staff have done a lot of work. I've asked a lot about, hey, it's not just enough to say, we think we can do this in a way that's more cost effective than the private sector or a nonprofit. We did put out the RFP that Krista talked about, spelled out what we were thinking we wanted, and it came back, and our current model for delivering this service is less than what was quoted to us. So I do think this is one of those areas which you've heard about before. Another example of this is what the health department did a number of months ago, about a year and a half ago now, the change from Start Right to the Nurse Family Partnership. Again, a delivery model change. We wanted to be very transparent like we did in the budget, but also in this presentation. Let you know what we're doing. We'll report back to you on those key performance indicators that Krista laid out. We need to find how we're going to collect those, but those are our ideas about how do we know that it's working. It's not just enough to be less expensive than our previous model. It's going to have to deliver on those engagement pieces, those family engagement pieces, and hopefully we can show that long-term that we see a benefit in terms of recidivism. But overall, that's kind of the pilot plan. Again, not asking for any formal new position creations. If the model works as we kind of right now envision it to, we'll certainly come back before the board and ask for that formal adoption of this delivery model through new positions. But right now, we're going to do a pilot. And then, of course, happy to answer any questions, or if you do after hearing the presentation, like Krista said, hey, reach out to so-and-so. They really would, I think, be very helpful to be kind of, like Krista said, one of those mentors to youth. If you've never attended a Wisconsin Counties Association event where they have a human services focus, very often you hear, like Krista talked about, protective factors. It's one relationship, right? Like if you have one really solid relationship with an adult, it can make all the difference in the world for a youth that is otherwise struggling. So with that, don't have anything else to add, but happy to answer any questions or take any feedback you guys might have.
Thank you. And Krista, thank you so much. This was incredibly informational. The stuff you had in the packet was so thorough, and you can tell that your team really was thoughtful with it. So I really appreciate that. There are questions for Krista?
Yes, I have a question. First of all, I can see where there's a definite need for this service. I think it's important. When is the program supposed to start? I didn't catch that. The new youth center.
We're hoping to have youth be able to attend the youth center beginning June 3rd. So we're currently in the process of getting our lead worker hired. Then we'll get all the policies and procedures. We'll hire those 2 additional workers and get them trained. And then June 3rd, we're hoping to have youth come to the center. I did run some data. I didn't provide this in there, but just about like how many youth do we have right now, right? If we opened it today, can we fill with 10? We have 29. We have
But,
29
okay.
youth who currently are not abiding by their court orders, who have no accountability for that we would look at the potential. Now, we'll have to make sure our kids are a good fit for each other, right, and evaluate those things. But we do have youth right now who could enter the program.
Okay, thank you.
Welcome, thank you.
Supervisor Krause?
Thank you, Chair. You had mentioned that some of them are willing or happy to return to their families. And I'm wondering if there aren't some of them who have problems in their families, and that's why they're acting out. And then in the family events and things like that you plan or have people around, is there like a family counselor working with them, or a psychologist, therapist, psychiatrist?
Yeah, so that's dependent on the youth, if they do have a formal family counselor that's working with them, or if it's something that their social worker is sort of walking through and working with the family during their regular visits. Also depends if they have a diagnosis or they don't. Are they on CCS services, or are they not? For what services, what mental health services they're able to receive. When I mention these youth who often will go into out-of-home placement, it's just a struggle sometimes of their parents saying, I can't provide the supervision that they need. I can't meet their mental health needs. I can't meet their behavioral health needs. And, would I say the reality is there's family problems? Of course, right? We all have family problems. The severity of those is just dependent on what their experiences have looked like. And so we have some families who it's like, you're right, you could not manage this child's mental health needs. They'll be unsafe no matter what you do, right? You'd be the best parent we could possibly put together, and some youth's needs just can't function in a family setting. Now some can, right? And then it's those parents who are like, I just don't want to, I don't want to. Like, it's been nice not having them and not having to leave work to go get them from school because they're suspended 6 times during a month. And so we get just a lot more resistance from those kids who maybe did go to that level of placement, like a group home level placement, that they just can't possibly come home. Whereas this way, we avoid them ever leaving. So they remain engaged in those daily parenting tasks. They remain that your child is coming home at night. We'll have conversations about when they get back here at 6 o'clock, what does that need to look like for you? How can you support this? But we don't ever leave them like, whew, I'm finally free for 6 months and I really don't want that stress back into my life. That sometimes is even more difficult than getting these youth ready to come home. That home environment has to change when youth are placed in out-of-home care. If we return them to the same home environment, whether it's a youth justice case or a child protective services case, it's not going to work. They were removed for a reason. There were family dynamics that were at play one way or another. So we have to address those.
So just to add one thing, and again, this is kind of when Kristen and her team put together this proposal and brought it to me, one of the things, thinking back to when I used to go into court and work with social services on these sort of cases, or in the DA's office handling youth justice cases. A concept that you often hear about, and Krista alluded to it, is this idea of essentially respite care, like people need a break. It's not that they can't do it, they just can't do it all the time. And I think this is, in my mind, as I was considering this and thinking it through, and Krista was presenting me with these ideas, that's a real asset for the kind of the scenario-based portion of this that Krista gave you. It's that there's something missing that this model, service delivery model, can offer that right now just we don't have, and it's that, hey, I need a couple hours a day, or my child is on an individual education plan like the scenario, and they're half days of school, but the other half I have to work, and I can't find a consistent respite care provider to provide that. This can be that thing where they're that place where they're getting those services. So it's that bridge between, if things get bad to a point where right now without the kind of this delivery model, the alternative is that higher level placement, which, as Krista alluded to, it's difficult sometimes to have that child return home. This is that temporary break, and can be a planful break where people can kind of refill their bucket or develop those relationships where they can be positive and be in a productive area without necessarily always having the parents be those caregivers, or quite honestly the schools sometimes be in a position where they're not able to take and have those behaviors all the time. So I think that's a valuable piece. Time will certainly tell on the utilization and kind of the outcomes, but I think it's certainly a very valid pilot relative to a model change.
Supervisor Cavelli.
Thank you, Madam Chair. And thank you, Krista, for bringing this program forward. As a former foster parent of many kids, some that have been to the shelter. I visited the shelter a few times, so I know exactly what you're talking about. If it's the one out in Sunnyvale, it was institutional at that time, and I'm looking forward to how it's going to transition into the mentorship program and things like that. I'm really looking forward to that because I think it's very valuable, and I think it's really truly needed. And I noticed after going through the foster care program with many kids is mentorship is important. And if you can teach those life skills, outside of, just between the families or the foster parents and the kids, and if somebody else can come in and mentor that, I think that's pretty valuable. The one question that I did have is if it's during the school year, and let's say they're suspended, are they going to get educational sessions during this program as well?
So there would not be like formal education from DPI, the Department of Public Institution, but there would be informal education assistance, right? So you're suspended from school. We have a week's worth of schoolwork to work on together, right? You're going to sit over here from 10 to noon, and I'll help you work on your math, right? Or you need to get this piece completed. So informal education, yes, but no formal instruction.
Okay, thank you. And thank you for the program. I think it's
you.
much needed.
Supervisor Coveli, your comment just made me think, I think it'd be a great opportunity because, again, based on hours of operation, we might be able to, once we get this up and running, have a tour for either this committee or even offer that to the full board. That was a thing that was brought up in a previous committee meeting earlier today on a completely different project, but it just occurred to me that, to your point, it might be helpful to show through this pilot and talk about the difference from that kind of institutional delivery model that Krista alluded to. I mean, this was operated by our sheriff's office. It served a purpose. It was that accountability piece, that sanction, but this is, certainly I think there's a component of that. There's still the sanction accountability piece, but it's an and with the report center pieces of skill development. So we can certainly arrange maybe later in the year to have that tour, if that would be interested, if members of this committee would be interested.
Well, that one may not be
So how do you determine who can go into this? If there is a troubled teenager, do they get kicked out, or do you just, how do you, it's an awesome idea, but not everybody's gonna comply.
Correct, right. So youth will be court ordered to attend. So they have already had to receive, be at that level where they're court ordered on youth justice. So they'll be court ordered to attend. Will we have youth, right, who say, okay, I'm showing up, but I'm going to be disruptive the whole time? It's possible. And that's where the training of our staff comes in and the skills of our staff to redirect, to engage, to talk about what are we doing out here today? You're court ordered to be here. I get you don't want to do it, but what would you do? Well, I'll go garden all day. Great. Go garden all day long. That'll be fabulous. And so I think it's really going to come down to the skills of the staff that we have out there for redirectability. Will it be possible that we have a youth who demonstrates some unsafe behaviors, right? Like swearing and maybe throwing a chair. We expect that to be occurring, hopefully not on a regular basis, but it will. And I think just our staff knowing what to expect, how to redirect, where we can move youth to, having the support of secure detention staff if we have somebody who's really out of control that we just cannot calm down, being able to rely on North Central to come out and maybe evaluate a youth. Is their mental health needing something more like crisis at the moment? Or to that point, can we just redirect? We can say, hey, yeah, you didn't get much sleep last night, go take a nap for 2 hours. We do have some youth who are in that situation, right? Their home environment isn't great. I didn't get good sleep last night. Now I have a lot of behaviors. I also haven't eaten breakfast. So some of it is just getting back to the basics. Like, you need a nap, take a nap, and we'll revisit this in a few hours. So, if you've been out at shelter, it is institutional. And so we will be making quite a few changes to that environment, just of what it looks like and it feels like, right? There's big metal heavy doors right now that lock. Doors are coming off. The beds that are in there right now they're attached to the floor beds. We're not looking to keep those sort of materials. So let's make this something that's homey, that's comfortable, that you feel safe at. Ultimately, we hope this is a place where kids want to come. They're like, let me come back to the Youth Opportunity Center. I have fun. I have a connection, right? I'm no longer ordered to go, but I want to be there because of the environment that you created for me. And to the earlier point, we're going to have to look at the youth who are out there together. We can't have the potential maybe of 2 youth who are from, maybe they run with different gangs. We're going to have to be careful about those sort of things and who we combine. But also, maybe putting them together in this sort of environment is also a good thing, depending on who else is out there, depending on the skills of the staff member. So there will be quite a bit of trial and error as we get started, as we see what kinds of behaviors the youth are going to present us with. And all of these kids, again, are already on an order. So the youth justice staff know these youth. They know what their triggers are. They know what their typical behaviors might look like and what to expect. And so when we're talking about our first group of kids who potentially goes out and all of our subsequent groups, it's going to be, are they a good fit for each other, right? This will be boys and girls together. We're not talking this just for males or just for females. So we'll have those things, right? Like, what are they doing walking that way? Which is why just having 10 staff and having the appropriate staff to youth ratio is going to be so incredibly important. And it's possible that, we only have 6 youth because those 6 youth's behaviors is all that we can manage based on the 3 staff that we have over there.
So if it's court appointed, does that mean that they have a certain amount of time that they spend there?
They could, right. The
Okay.
judge could choose to say, Johnny, who's suspended from school, who got something else, he's not abiding by his court orders, you're going to be out at the Youth Opportunity Center for the next full week while you're not in school, and after school hours, you are also ordered to the Youth Opportunity Center from 3 to 6. So I think there could be a wide variety. We might have kids who are out there all day. We might have kids who are just on that individual education plan and need it for the morning. Some might just need it for the afternoon. And parent work schedules, right? Like a lot of parents end up working after school hours, and so maybe a kid's in school all day, so they just need to come after school until their parent gets home.
One more question. Those students, those youth that come into this program and really like it, and then they're released from it, what opportunities do we have if they can't come back because they're not court appointed?
Yeah. I think all of the opportunities, for the most part, still exist, right? All of those individuals, maybe they connected with somebody that we brought in. We can still make that connection. We're still open on an order with them. Maybe they really connect with the lead youth justice worker who's been out at the Youth Opportunity Center with them for the last month. We could still have that worker have a connection with that youth. So that is the nice thing, and another positive to running this program internally. We don't have that conflict of, oof, you're no longer a PSG client, and so we can't connect with you anymore. You're still always have been being served by youth justice. It's just the location at WITH. So those people can still remain connected to those youth, so we don't ruin those connections. Youth who are attending this Youth Opportunity Center have a difficult time making connections. That's typically just a concern that they have, and so we certainly don't want to say, great, you now have a great relationship with Krista, thanks for building that and trusting her for the last 6 weeks, and now she's gone. Hope you can do it with somebody else. We would say, like, Krista, we want you to still check in with, Johnny every week, and maybe they help to transition that relationship from me to somebody else, right? Is there a teacher or a volunteer or something like that who can come in and sort of take that place of that individual?
Thank you.
Thank you.
Supervisor Krause?
Thank you. In your example of 16-year-old youth Duncan, sending pictures of him holding a handgun, I was wondering, you mentioned about removing the thick, heavy steel doors or whatever, and I'm wondering if you're making it more comfy and cozy and more relaxed, like fun, positive situation, what kind of protection and preventive measures do you have so that none of them may be bringing a gun or a knife into the building?
I think those are still policies and procedures that we have to work out with our lead worker coming in. We don't have, we're not going to walk through a metal detector coming into the Youth Opportunity Center. So again, I think it goes back to that youth justice worker knowing their youth and having that really good relationship and knowing, like, hey, if Krista's coming, you're going to have to, check her down, ask her to empty her pockets. If she's wearing a big coat, like, that needs to come off before we go in. We're not, bringing backpacks in that we don't check for. So we'll have to develop still the policies and procedures to ensure those safety pieces, but they will be in place.
Are there any other questions for Krista? Okay, thank you so much.
Thank you.
All right, so that brings us to the end of our agenda. Item 8, next meeting date and time, announcements and future agenda items. 8A, committee members are asked to bring ideas for future discussion. And 8B, next meeting is Wednesday, April 3rd, 2024 at 3 p.m. And I recognize that that is the day after the election. So some of us will no longer be board members, but we are until April 16th at 7 p.m., right, Kelly? So we will be having a meeting. If for some reason you think that you will not be attending based on just the election happening and the outcome of that, can you please let me know as soon as possible? Because on our agenda for April, we are slated to have representatives from the city of Wausau here to discuss their challenges with the homelessness issue in Wausau. And so I want to make sure that if we don't have a quorum, we're not wasting anybody's time. So if you think that there may be a reason that you will not be coming to the meeting, please let me know as soon as possible. That brings us to item 9. Do we have a motion to adjourn?
Motion to adjourn.
Motion by Supervisor Gottering, second by Supervisor Krause. All those in favor say aye. 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 Opposed? None opposed. We are adjourned. Thank you.
And thank you, Michelle, for all that you've done for the past 2 years.
Yeah, you're welcome.
Yeah, we appreciate it.
That's April 3rd, that's the election, huh?
No, the election's on the 2nd.
Oh, then I'm okay.